Hello everyone. So today in this video we are discuss about the uh, question that is what is stroke, the risk factors and the early warning signs of the stroke. Okay, so this question were asked in exam many times in 5 marks. So let's discuss now what is stroke and its risk factors and warning signs. So stroke basically also known as cerebrovascular accident or the cerebrovascular attack, it is also known as. Now, the definition of stroke is what? It is the sudden loss of neurological function caused by, okay, अचानक से हमारे जो न्यूरोलॉजिकल फंक्शंस है इन द बॉडी दैट लॉस and it the process is the sudden, this process is sudden. Now it occurs why? Because of the interruption of blood flow to the brain. ओके एक एग्जांपल कि अगर हम रास्ते में बाइक लेके जा रहे हैं एंड अचानक से स्पीड ब्रेकर आ जाए कि दैट यू डोंट नो, सो हमारा जो बैलेंस है वो अल्टर हो जाएगा, मीन्स कि जो प्रॉपर फंक्शन है वो अल्टर हुआ. सो इसी तरह इन दी अवर ब्रेन अगर ब्लड फ्लो जो है नॉर्मल उसका इंटरप्शन होगा ड्यू टू सम रीजंस, सो जो नॉर्मल न्यूरोलॉजिकल फंक्शंस हैं उसका क्या हो जाएगा? सडन लॉस. So the definition is sudden loss of neurological function which is caused by the interruption of the blood flow to the brain. And the stroke is also known as the cerebrovascular accident. The second is stroke classification. Now basically the stroke is classified into two forms, the ischemic one and the hemorrhagic one. The ischemic stroke is what? So ischemic stroke is the result of the thrombus, embolism or any other condition that produce the low systemic perfusion pressure and that result in the lack of cerebral blood flow in the brain and the needed oxygen and glucose. ठीक है, अगर अचानक से कोई थ्रोम्बस या एम्बोलस की वजह से जो सिस्टमिक परफ्यूजन है वो लो हो जाएगा और उसकी वजह से लैक ऑफ सेरेब्रल ब्लड फ्लो की वजह से इन दी अवर ब्रेन ऑक्सीजन एंड ग्लूकोज लेवल जो है वो भी डिक्रीज हो जाएगा एंड दैट अल्टीमेटली लीड्स टू द इंजरी and the death of the tissues in our brain. So that is what about the ischemic stroke. The second one is the hemorrhagic stroke. Now basically hemorrhagic stroke occurs when the blood vessels rupture and due to that it causes the leakage of blood in or around the brain. Okay, so that is what about the hemorrhagic stroke. Hemorrhagic stroke basically classified into again two categories, the intracerebral hemorrhage and second is subarachnoid hemorrhage. Now what is intracerebral hemorrhage? Hemorrhage is basically caused by rupture of the cerebral vessels with subsequent bleeding into the brain. Okay, and basically it happens into the small blood vessels. And second is subarachnoid hemorrhage that occurs due to the bleeding in the subarachnoid space and it basically affect the primary large blood vessels. So this is one the minor difference between the intracerebral and the subarachnoid hemorrhagic stroke. Now the risk factors of the stroke or the cerebrovascular accident risk factors are the hypertension, diabetes mellitus patient, PAD that is peripheral artery disease patient, in that 30% chances of stroke is occur. Then in diabetes mellitus 15% chance for the stroke. Then high blood cholesterol, heart disease. In heart disease patient have 30% chances of stroke. Then smoking and tobacco use patient. Other risk factors are any cardiac disorders like rheumatic heart valvular diseases, CABG that basically increase the risk of embolized stroke, and CABG means the coronary artery bypass graft, that is one of the cardiac surgery. In that surgery the risk of embolized stroke is increased basically. The next risk factors is atrial fibrillation which is the powerful factors of the ischemic stroke. So this is what about the risk factors of the stroke. Basically the warning signs means કે શું કહેવાય લાઈક પ્રિકોશન ઓર ચેતવણી ઓકે કે સ્ટ્રોક થવાના ચાન્સીસ છે. સો ધીઝ આર ધી વોર્નિંગ સાઇન્સ સચ એઝ TIA, Basically, TIA means what? It is the transient ischemic sudden attack. Okay, and basically it occurs due to the interruption of the blood flow to the brain. Sentence is like that कि TIA is the precursor of the stroke and other cardiac diseases. Then second warning sign is sudden numbness of the arm, face and leg on one side of the body. Then sudden confusion and trouble in speaking, that is also one of the sign of warning. Then severe and sudden headache, weakness of arm, face and the leg, sudden trouble in the walking, a patient have difficulty in the walking. Then dizziness and loss of balance or the coordination, and seeing trouble in the one or both eyes. So these are the warning signs of stroke. Thanks for watching my video, and if you like my video, please share and subscribe my channel for more videos.